Good afternoon, everyone, and thank you again for listening in on this latest COVID-19 update. This week, the state rescinded the stay-at-home advisory that was in place from 10 p.m. to 5 a.m. It also canceled an early closing order requiring many businesses and restaurants to close at 9:30 p.m. each evening. However, the 25% capacity limits remain for most businesses, along with all the other public health safety guidance, as we all continue to fight COVID-19 while ramping up the arrival of vaccines in all regions. As many of you already know, the state's timeline for vaccine distribution is divided into 3 phases, with frontline workers in COVID-facing environments, including hospital workers, getting the first doses, followed by other vulnerable groups in later phases. Our health department, in collaboration with our neighboring communities, held 2 vaccination clinics for our first responders. My thanks to Frank Giacalone, Health Director, his staff, and all the staff and volunteers who came together to coordinate a successful vaccination administration site. We still have the remaining sectors of Phase 1 to complete at the local level, which includes those living or working in nursing homes and assisted living facilities, along with the second dose to our first responders. As of yesterday, our senior residents, 75 years and older, are eligible for vaccination as a first priority in Phase 2, which begins February 1st. They are now able to schedule an appointment for the vaccine online at one of dozens of locations across the state. While some appointments are open, please note that it may take several weeks to get an appointment at a location near you. As more vaccine supplies arrive in Massachusetts, additional appointments will become available. It is expected that a large number of residents are trying to secure a limited number of appointments. But if you can't initially secure an appointment right now, keep checking the website. Individuals in this category with questions about how to get a vaccine should follow these steps. Visit mass.gov and click on COVID-19 vaccine on the home page. You can then click on When Can I Get a Vaccine and view vaccination location maps and make an appointment. At the local level, I am thrilled to announce a vaccination site for Newburyport. We are partnering with Anna Jakes Hospital and the Beth Israel Lahey Health Network. The Anna Jakes community serves approximately 100,000 patients, of whom estimate 10 to 15% are patients age 75 and over. Planning is underway for Beth Israel Lahey Health to run the program for this population as soon as early February at the Senior Community Center. The site will be capable of vaccinating 500 patients per day, 2,500 per week when it can be fully utilized. How many people can be invited to receive the vaccine will depend on how much vaccine supply they receive from the state. We hope to continue hosting the site through mid-April. For now, patients in their system in the Beth Israel Lahey Health Anna Jakes Hospital system who are identified in Phase 2 at age 75 plus, followed by age 65 plus that are next in priority, will be receiving a letter, text, email, or phone call from their physician on how to register for the vaccine. We also plan to engage our Council on Aging to assist our seniors and those needing assistance with the registration process. We are still working out details, so please be patient for just a bit longer. We are very close. Also included in Phase 2 are those with pre-existing health conditions, grocery store workers and sanitation workers, and our educators. This week, the North Shore Superintendent's Group worked with 29 other communities to support a request to the governor and Commissioner Riley asking for our educators and school personnel to be moved up in the vaccination priorities. This has yet to be determined. However, I just got off a call with Cataldo Ambulance, and we are working out a plan at the end of February to vaccinate our teachers in the Newburyport School District. More details will be following. Furthermore, our health department is continuing to work with our neighboring communities, as we did with our first responders, to develop additional sites for vaccines. As you may likely know, the federal government is working to increase the manufacture and distribution of vaccines to the states. So once the flow of vaccines is increased, we can collectively make it happen. The understanding is such that each resident will have multiple options from where to get vaccinated once eligible, but this will take some time. The vaccine will be made available to the general public in Phase 3, which is not scheduled to begin until April, providing the vaccine supply is available. There are so many moving pieces, and we learn more each day. We will continue to do our best to keep information flowing and help each of you navigate this vaccination process. I'm just asking for you to give us a little more time as we work out all the particulars of how we're setting up these vaccination sites, and then you will receive broadcasted information about these sites. Thank you for your patience and cooperation. On a hopeful note, after a significant spike in cases throughout and after the holidays, the numbers have leveled off and trended downward for the past 2 weeks. While Newburyport remains in the yellow category this week as a medium risk community, we have seen a decrease with 77 cases in the last 14 days compared to 143 cases in the prior 2-week period. Even so, we need to keep being thoughtful in our actions. Wear masks whenever we interact with others, especially indoors. Keep a 6-foot distance. Don't get together indoors with people outside of your household, and wash your hands frequently. We are making progress, and there is an end in sight. But for the next few months, we must continue to stay vigilant and take the steps necessary to stop additional spread. In regards to businesses, I'd like to mention a few important items. I am happy to announce we were awarded a state shared street grants program for $280,000, an extension of a program initially launched in the summer of 2020 to help municipalities address the economic challenges impacting businesses amid the ongoing public health crisis. The grant will be used to design and install parklets for outdoor dining and to make pedestrian improvements on State Street in support of public health, safe mobility, and renewed commerce. We hope to begin this work by mid-March, weather permitting. Also, Amesbury and Newburyport, as part of a grant awarded from the Department of Housing and Community Development, is still accepting applications to specifically support small businesses affected by the pandemic. Eligible small businesses can still apply for up to $10,000 in grant funding, which can be used for operating expenses such as payroll or rent or mortgage payments, or hiring a consultant to provide legal, accounting, marketing, and/or web development services. There is still about $190,000 left in this account. Please, if you're eligible, do apply. Please check our website or Amesbury's for more details. The city also has funding available for those having difficulty paying rent due to the economic impacts of COVID-19 from our Emergency Rental Assistance Program. The grants provide short-term rental to low and moderate income families whose incomes have been adversely affected by the pandemic. To learn more and to apply for assistance, please contact the Pettingill House at 978-463-8801. In other city news, we have also begun coordinating activities with our new Diversity, Equity, and Inclusion Alliance. We are working on some additional training for the Alliance while at the same time conducting an assessment of our city on this subject, our strengths, weaknesses, opportunities, and threats. We hope to share some information with the community soon. The Alliance is also participating in the community read of Just Mercy by Byron Stevenson. I am pleased to announce that Paula Burke has been hired as the new Council on Aging Director. Paula comes to us from the town of Topsfield, where she served for 25 years in a variety of roles, most recently as the Executive Director for their Council on Aging. She will be responsible for planning, organizing, and directing all Council on Aging initiatives and programs. Please join me in welcoming Paula to Newburyport. On behalf of the City of Newburyport, I express my deepest thanks to Congressman Seth Moulton and our Senators Warren and Markey and our local legislative team for their efforts in securing $7.3 million in funding for the Newburyport Harbor Federal Navigation Project in the U.S. Army Corps of Engineers fiscal year 2021 work plan. The funding will allow the federal channel to be dredged for the first time since 2010. The project is critical to open the river and navigation channel and will help Plum Island with the serious erosion and rebuild of the beach in the Reservation Terrace area. We continue to work with Congressman Moulton, Senators Tarr and DeZoglio, and Reps. Kalkhorst and Mira on the need for a protective solution for the water sewer infrastructure and homes until the dredge project occurs. We are also working with Lieutenant Governor Polito and state agencies on a solution. So much has happened within our nation over the last several weeks, and along with COVID-19, our world has changed in more ways than we could have imagined. With the inauguration of the new Biden administration before us, our government has much before them in a fourfold crisis to prioritize: the COVID-19 pandemic, a profound economic downturn, extreme climate impacts, and a national reckoning with racial inequity. We are at an inflection point, and for all of us, the stakes could not be higher. There are good days ahead for us. And please do stay vigilant. Remember to do everything you can to help each other to get through to the other side of the pandemic. And in the meantime, please reach out and help friends, family members, and neighbors. Let's hope, find good and joy, and have thanks for each day and every way that we can. Thank you.